Hey everybody, Dr. Monika from Lift Laugh Kegel here today, and we are going to be talking about labor and delivery positions. So first distinction that we need to make is that labor and delivery are actually two different things. So labor is everything that happens when the cervix is dilating, meaning it's opening up and it's thinning out, and as the baby starts to descend into the vaginal canal. Delivery is actually giving birth to the baby, right? That's like the main event that we all think of. So there's different positions that will help you with each of those because there's different goals. If we try to get the baby to descend into the vaginal canal, that's different than actually trying to get the baby out of the body. So during labor, it's important that you're moving around a lot. And it's important that you're in positions where your body, like the baby, is going to be pulled down by gravity, because as the baby's head comes in contact with your cervix, it helps that cervix to thin out and to spread apart. So being on your back during labor isn't ideal because there's not really going to be a lot of that contact, and so your labor may take a little bit longer. Versus if you're able to get up, to walk around, to change positions, to get on a birth ball, which in case you want to know is really just a yoga ball. Like go on Amazon, look up exercise ball, get yourself one that's like 55, 65 centimeters and you're good to go. So moving around on one of those, getting on your hands and knees. There's that video that went viral with the Brazilian doctor who does the dancing with his patients. That is a great labor dance movement, whatever you'd like to do. But being upright, moving around, and changing position. Because that change in position is kind of telling the baby like, hey, you got to move along, like we're going to be doing something else now, and can help to promote the baby to descend further into the vaginal canal. So labor, I really want to encourage you to move around and be as active as feels good for you. You know, maybe you're not running that day, but you are doing some different types of movements. Now, when it comes to birth, there's a few things we got to talk about. So when I'm making recommendations for birthing positions, my number one thing is, first off, you and your baby both have to be doing well, right? In an emergency situation, all of this stuff is going to go right out the window, and we're going to make sure that we take care of you and your baby. But if everything is going well, and like 70% of births at the start of the birth are considered low risk, so most of you are going to be able to go through with this type of advice, obviously working closely with your provider, whether that's your midwife, whether that's your OB, if you've got a doula with you. So when it comes to birth, I am looking at how can I get the best outcome for that mom's pelvic floor? So we talked about the pelvic floor muscles. We talk about the area known as the perineal body. That's between the vagina and the anus. And that is where they're going to do an episiotomy. An episiotomy is when they cut through that area to help open it up more. Now, it is not standard practice to do episiotomies on a woman who is having a low risk normal birth. So please do not accept that. And if your doctor is offering you an episiotomy, there might be a very valid reason for it, but you need to ask why. I've had several patients tell me like they didn't know that they had the option to say no to an episiotomy, and it wasn't for, like a medical reason. So unfortunately, it is sometimes still performed, even in cases where perhaps it doesn't need to be. Because when they do an episiotomy, they're automatically cutting into those tissues. And we can't actually predict 100% who is going to have a lot of tearing and who isn't going to have a lot of tearing. But for first-time new moms, there's a few things to consider. First-time mamas are the most likely to have tearing just because your tissue isn't used to it, especially if you're told to do directed pushing. So if you're in the hospital, you become fully dilated, and then the nurse or the doctor, typically the nurse, will say to you, all right, push, hold, and they tell you to hold your breath and to strain and to bear down. And we have research to say that that is not the best thing for women to be doing. What we should actually be doing once you're fully dilated is waiting for the mom to get that urge to push, because that is when the baby has actually started to descend. You get the urge and that further pushes them down and out. So that is the most effective way to do pushing, and then pushing without holding your breath. So this is important. Pay attention. Key takeaway. Your pelvic floor muscles do not deliver your baby. Just like when you pee and poop, the pelvic floor needs to open and relax down and out. Your uterus is going to be generating those contractions, right? The ones that are so painful that everyone is like, oh my God, I don't want to feel the pain of the contractions. That uterus is actually pushing the baby. You are also going to do pushing with your abdominal muscles, not with your pelvic floor. So the best position for a woman to give birth in is a position in which her pelvic floor can relax. And that is going to vary by woman, by what your day-to-day activities are. Like we talk about squatting, and squatting could be a really great position to give birth in, but not if you don't squat all the time. Like, I hate to break it to you, but if you have a very sedentary lifestyle and you don't squat, when you get into a squat, your pelvic floor is going to tighten up, and that's going to be really hard for you to maintain that position, but B, it's actually not going to be your best birth position, and that's okay. So we don't have a standard, like this is the position you have to give birth in, but we do know that when we put women on their back and we tell them to push when their body's not telling them to push, they tend to have worse outcomes. The baby's oxygen tends to drop faster. The mom isn't doing as well. If we start to see that the baby's going into distress, usually that leads to a cascade of other interventions. And that's when we start talking about maybe having to use forceps, having to do an episiotomy, different maneuvers. And so if we can get you and baby to be doing the best during the birth, right, that's ideal. That's what everybody wants. So a couple things. First-time new moms, the most protective position for you to give birth in for the pelvic floor overall, not for everybody, is laying on your side, actually. And I would say that pretty much none of the moms I've ever worked with have even realized that's an option. So OBs are trained to deliver women inside lying. So you can lay on your side, and that's very protective for your pelvic floor muscles. Other birth positions include, yes, the squat, but if you want to give birth in a squat, and kudos to you if you do, you got to start squatting yesterday. You are not going to pop into that delivery room and just be like, all right, here I am, I'm going to squat this baby out. I do not recommend that. And neither do the other birth birth providers that I've worked with. That's what I'm trying to think of. So yeah, if you want to do a squat, that's great, but I'm going to need you to start squatting and to relax your pelvic floor at the bottom of that squat, which is different. If you've been squatting for exercise, that's not the way that you've been practicing this. Pretty much can promise you it's not. So you're going to have to work with someone. Hey, guess who you could work with? A women's health physical therapist. So one of the things we do are birth assessments, where we'll actually figure out which positions are going to be the best for you to give birth in. Hands and knees is another awesome position. You could do hands and knees with that big yoga ball underneath the chest. That way your arms don't have to do all the work, and that's actually a really comfortable position for a lot of women. You could be sitting back, but not laying back all the way, so that way you're still upright, which does make it easier for you to be able to push. Or you could try other positions as well. So this is not a comprehensive list by any means. Standing, sitting, lots of different modifications. Overall, what we recommend is the position that your body feels best in. So if you're someone who's also maybe having pain during your pregnancy, if it's low back, pelvic pain, what can be important too is to work with a women's health therapist to figure out which positions are going to be best for your body. Not only to protect your pelvic floor, but especially because if you're going to get something like epidural or some type of pain medication, you might not feel that the position you're in isn't doing great things for your low back, your pelvis, your hip that's hurting. And you don't realize that till hours and hours later. Birth is over, things have started to wear off, and you're like, oh my gosh, why is this hurting so much? Well, you could have just been in a position that really wasn't that great for you, and your body couldn't feel it, so you never got the warning signs to move out of that either. So that's another option, is if you're having pain, definitely work with someone, because we can help you to figure out what is best for you. And then bring that to your provider. So it's awesome to have this knowledge, but the next step is to take it and to talk to your midwife, your OB, your doula, talk about it with whoever's going to be in the room with you, whether that's your partner, anyone, and figure out, how likely am I to be able to do this? So I want you to go back to your provider and to say, hey, here's the information I have. For instance, I will give all my patients who I do this with a sheet with the recommendations. Based on the assessment we did, I recommend blank, blank, blank. Here are positions that really didn't feel so good, or perhaps they weren't able to get a good relaxation in. Go have that conversation with your provider and figure out, is this something that they're going to be able to do in that birth setting for you? So, key takeaways. Labor and delivery are two different things, but you want to be moving around and upright. You want to make sure that you're pushing when you feel the urge to push. And that's something important to talk about wherever you're going to be doing your delivery. How do they do pushing? Are they going to be telling you when to push? Are they going to give you the time to rest? Sometimes a woman becomes fully dilated, and we're finding out that this is happening a lot, actually. We used to think it was abnormal, but not so much. A woman becomes fully dilated and she doesn't automatically get the urge to push. There can sometimes even be up to a few hours delay between that, and then you will start to get your natural urge to push. But if you're in a setting where the moment you're dilated, they're telling you to push and your body's not ready for it, we know that that has worse outcomes for the mom, for baby, and certainly for the pelvic floor muscles. So thanks, guys. I don't see any questions. Dancing is fun. Yes, it is. No questions. All right, awesome. So hope you guys found that video informational. If you have any questions, feel free to comment down below. Send me a message. I can do a follow-up post if anyone has any other questions on this. And be sure to share with a pregnant friend. Have a great weekend, guys.